My name's John Hardy. I'm a consultant knee surgeon in Bristol and London. And I've got a case for you today of pigmented villonodular synovitis. It's the localized type and it's on the right knee. What I'm going to do is make two little incisions, one laterally for the arthroscopy camera and one medially for the instruments. I'm going to use a punch and then an Arthrocare Ambient Super Multivac 50 radiofrequency probe. It's got a little meniscal tear. I'll deal with that as well. Now we're looking from the lateral to the medial side of the joint, and there's the PVNS. First thing to do with this is identify the pedicle, because you want to be able to remove the PVNS at its pedicle and then seal the pedicle using this Arthrocare Ambient radiofrequency wand. Not all punches are suitable for this sort of equipment. This is a 90-degree punch to the right. I'm going to find a much thinner punch to get around that pedicle. Once you've got around the pedicle and separated the PVNS from the surrounding tissue, you've got to identify the blood supply and also make sure you're not leaving any PVNS behind. You see those little fragments of PVNS? Just make sure you've taken those away adequately. I'll even use a shaver to get rid of them at one point. Make sure you clean the punch off. The grabber there to remove the PVNS and send it for histology. Use the shaver to remove any loose bodies. I've done that at the back of the knee there. And this is a great suction device, this Smith & Nephew. Here's the ambient radiofrequency wand from Arthrocare. Very useful. Make sure that the temperature of the probe never goes up above body temperature. I've got it set on 45 when it alarms at 45 but it never reaches 45. Now PVNS is probably related to some intra-articular hemorrhage, and so whenever I do an arthroscopy I always make sure that all the bleeding points are sealed using this radiofrequency wand from Arthrocare. Really good bit of kit. And I'll go down and just seal off the base of the where the pedicle was for the PVNS, and this patient's been reviewed 2 years down the line, no recurrence on MRI. Thanks for watching, hope it helps.